An emerging health concern is making headlines across the globe. Human metapneumovirus, or HMPV, has now been detected in India, with 2 confirmed cases reported in Karnataka and 1 suspected case in Gujarat. With reports of a surge in HMPV-linked cases overwhelming hospitals in China, it's no surprise that these new cases in India have raised concerns. So, what do we know about the cases in India? The first confirmed case was reported in Karnataka's Bangalore, where an 8-month-old infant tested positive for HMPV. The child, admitted to Baptist Hospital, displayed no severe symptoms and has since been discharged. A second case was identified in a 3-month-old infant in the same hospital. The child was initially treated for bronchopneumonia before the HMPV diagnosis. Meanwhile, in Gujarat, a 2-month-old baby is suspected of being infected, according to local media reports. While the case is yet to be officially confirmed, the child is under observation at a private hospital in Chandkheda. Interestingly, neither of the confirmed cases in Karnataka nor the suspected case in Gujarat has any history of international travel. Amid these developments, the Union Health Ministry has stressed that India is well prepared. A joint monitoring group meeting chaired by the Directorate General of Health Services reviewed the situation, noting that the surge in China is consistent with the flu season and not unusual. The central government highlighted that India already has a robust surveillance system in place for respiratory illness like influenza-like illness and severe acute respiratory infection. Current data from the Indian Council of Medical Research and the Integrated Disease Surveillance Program show no significant spike in these conditions. As a precaution, the ICMR is scaling up laboratory testing for HMPV and closely monitoring trends nationwide.
Health experts have clarified that HMPV virus is not a new virus. It was first identified in 2001 and it has been circulating in the entire world since many years. HMPV spreads through the air by way of respiration. This can affect persons of all age groups. The virus spreads more during the winter and the early spring months. On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research, and the National Center for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. WHO has taken cognizance of the situation and will share their report shortly with us. The country data for respiratory viruses available with Indian Council for Medical Research, ICMR, and the Integrated Disease Surveillance Program has also been reviewed and no surge in any of the common respiratory viral pathogens is observed in India. Joint Monitoring Group meeting was held under the chairmanship of Director General for Health Services.
Meanwhile, states have stepped up their preparedness efforts. In Delhi, health authorities have issued guidelines to improve viral case isolation and ensure hospitals are equipped with adequate supplies. This includes oxygen medications and personal protective equipments. Hospitals have been directed to report ILI and SARI cases through the Integrated Health Information Portal for real-time tracking. Maharashtra has increased its surveillance efforts, with state health officials monitoring SARI and ILI cases more rigorously. In Kerala, Health Minister Veena George took to social media, urging citizens to take precautions like wearing masks and practicing good hygiene, particularly for high-risk groups such as children, the elderly, and pregnant women. Telangana's Public Health Department has also issued advisories, emphasizing the importance of following health guidelines while coordinating closely with the central government.
And he took up a meeting with the department, and whatever decision he takes, the government will implement it, and the government will take all precautionary measures to implement and to prevent the disease.
Like about this virus, whether it's a new virus, so I can say it is not a new virus for us. It has been there in circulation in our country also. But as such, we see the way it is going on in other country where an outbreak has been reported right now. The same has not been seen so far in India. As such, there could be some strain variation which could be there in the new strain, which is causing the outbreak in the area which is affected by currently circulating HMPV virus. But if I see of that of condition in India, I can say right now we are not suffering any panic situation related to HMPV virus, but yes, preparedness is always required.
But what exactly is HMPV and why has it garnered so much attention recently? HMPV is a respiratory virus that belongs to the Pneumoviridae family. First identified in 2001 by researchers in the Netherlands, the virus often causes symptoms similar to the common cold. However, in some cases, it can lead to severe respiratory illness, particularly in vulnerable populations such as young children, the elderly, and individuals with compromised immune systems. The virus spreads through respiratory droplets or contaminated surfaces and can cause symptoms like fever, cough, nasal congestion, wheezing, and in severe cases, shortness of breath. Preventive measures such as washing hands, wearing masks, and avoiding close contact with infected individuals remain crucial.
So the human metapneumovirus, this virus has actually been in circulation since I think it was identified around 2001. It has been in circulation since then. Now it is a virus which actually mimics something like a respiratory syncytial virus which causes the bronchiolitis in the infants and in the young children. Now we need to just understand a very basic kind of a stuff. Now these viruses tend to infect the infants more and the immunocompromised more because of two different reasons. So as far as the infants are concerned, it basically affects the infants because in the infants they have not been exposed to the viruses, so they do not have the antibodies and enough and apart from that their immune system is also not fully developed. As a result, they are not able to fight out this virus. And apart from that, in case of the immunocompromised and the older population, when I say immunocompromised, those who are on the cancer treatment or have HIV, AIDS, or are diabetic, uncontrolled, they are the ones who are their immunity is low, so they tend to get this virus, and this virus actually gets away from their immune system, is able to overpower their immune system and then affect them.
Videos circulating on social media have shown overcrowded hospitals in China dealing with a surge in respiratory illness, including HMPV. However, the World Health Organization and Chinese authorities have not declared this a public health emergency. Back in India, the Health Ministry continues to stress that there is no need to panic. According to Directorate General of DGHS, India is well prepared to deal with any potential outbreak. He reiterated the importance of basic precautions such as wearing masks, maintaining hygiene, and isolating oneself when unwell to prevent the spread of respiratory viruses like HMPV. So far, the situation remains under control, with no significant rise in respiratory illness reported nationwide. Bureau Report, India Today Global.